Good evening, everyone. Today we'll be speaking on anti-inflammatory diet and a happy new year to everyone. And thanks to Arogyam UK for giving me this opportunity to share my little bits of knowledge with everyone, the beautiful community we have. So I'll be sharing the screen now and we'll start learning about anti-inflammatory diet, which is to say not per se a diet but a lifestyle, I should say, which is a complete, if you convert yourself into that lifestyle, you definitely will have a more healthier life. So let's begin. So today we'll be speaking about anti-inflammatory diet, a complete guide on anti-inflammatory diet. So for that, we need to first know what is anti-inflammatory diet. Anti-inflammatory diet, as I said, is not a specific diet per se, but rather a way of eating that focuses on mostly whole, minimally processed foods and incorporates foods that contain specific nutrients and antioxidants to help combat inflammatory process in the body. What is inflammation? Inflammation is a naturally occurring process that literally everyone experiences. If we fall, we have inflammation. If we have a flu, we have inflammation. If we have fever, we have inflammation. Whatever disease or pain we suffer from, it's due to inflammation. So inflammation is a very much needed process in the body in order to heal. When you have a cut, you have redness, swelling, and your immune system is trying to repair the injury. Inflammation can either be acute or chronic. With acute events, the body heals and the inflammation goes away. But it is chronic cases which need help. So inflammation persists in chronic cases and keeps the immune system in flight mode. This can often lead to symptoms including GI tract issues, joint pains, fatigue, muscle pain, depression. The list is endless. Anxiety. There are so many disorders that are caused by inflammatory foods or chronic inflammation. Some food intolerances are known to cause chronic inflammation. Certain medications are known to cause chronic inflammation, and even periods of high stress in your life can all be triggers of chronic inflammation. Before you can address inflammation, it's helpful to know what is at the root of it. Making certain dietary adjustments can help you reduce inflammation levels in the body, help you combat stress, as well as manage chronic inflammatory conditions such as autoimmune diseases. There are other ways to help lower inflammation, but looking into your diet is a good place to start with. Chronic systemic inflammation is a factor in diseases such as obesity, metabolic syndrome, prediabetes, type 2 diabetes, heart disease, inflammatory bowel disease like Crohn's disease, ulcerative colitis, some forms of cancer, arthritis, Alzheimer's disease. So basically, all these are kind of, you can say, preventable. If your diet is good, you can prevent or you can manage or you can reverse these conditions. So that is the reason why we are learning this today. Inflammation, you can fight it. Inflammation is not something which you can't fight. You can fight it. It can seem challenging at the first to eat for a lower inflammation with so many inflammatory foods commercially available. But over time, small changes can turn into lasting habits. This is what I always tell my fitness clients, my nutrition clients, that small changes which we make into our lifestyles will go a long way in helping us get rid of inflammation. While no one food reduces inflammation, building a healthy, holistic dietary pattern can help lower your risk of inflammatory disease and can transform your health. So what exactly are anti-inflammatory foods? These are the just ones that have been well studied to reduce inflammation in the body. So there have been certain studies conducted by giving these foods to a certain group of people and seeing the results. So these studies definitely show that these foods reduce inflammation. These are the items that nutritionists and doctors all agree that we need to get more of these because they reduce inflammation and also they have a lot of other health benefits. So, what are all these health issues caused by, like allergies, like acne, rosacea, blood sugar, high blood sugar, diabetes, infertility, insomnia, headaches, fogginess, indigestion, bloating, fatigue? These are the general symptoms you will hear from the patients: fatigue, lethargy, malaise, inflammation, pain, asthma, low sex drive, premenstrual syndrome, irregular cycles, depression, anxiety, emotional fragility, which is very common with it is because of foods, definitely. Hypertension, cholesterol problems, excess weight gain, you're not able to lose weight. If a major pathology is ruled out after proper investigation and you still suffer from these problems, then it's definitely metabolic chaos in your body, which is caused by inflammation. So, guidelines for anti-inflammatory diet. First step: remove refined, fake, and all added sugars. White and brown cane sugar, fructose corn syrup, refined stevia products, xylitol, artificial sweeteners, concentrated fruit juice, or anything ending in OSE, dextrose, maltose, sucrose, fructose. Read the label. It is important that you read labels of all the products you use. Don't just go get the product and start consuming it. First thing is to have the habit of reading the labels. Once you get into that habit, you will choose more healthier foods. Don't just pick anything up from the supermarket and get it home. Read the labels, see what it contains. If there are added sugars, try and avoid it. And remove gluten is something which is not a permanent thing, I would say. If you are seeing a patient with chronic inflammation, this is the first thing we do. It is a kind of elimination. And once the patient starts settling in, we probably try to introduce gluten and see how it does, whether it causes inflammation or no. If the patient is better and the gluten is working, then you can in future take. But then to start with, if you are suffering from chronic inflammation, to start with, we need to remove gluten because it is one of the known agents, especially the GMO, the genetically modified version of gluten or wheat, is more inflammatory. It is observed that causes chronic inflammation. So it is a protein component. Gluten is a protein component of many grains, including wheat, barley, rice, spelt, and kamut. Also found in many sauces and packaged items that you would not expect to find it in. So it's important you read the labels. They definitely mention it. And similarly, like I mentioned, gluten, we can also remove dairy products because these are also inflammatory in some people. So this is the first step. Later on, we can reintroduce if that is not the cause. It is kind of an elimination process. So remove dairy products made of cow's milk which contain lactose and beta-casein, including milk, yogurt, cheese, cream, and butter. Remove inflammatory oils, that is vegetable or seed oils, corn oil, soy oil, canola, grapeseed oil, safflower oil, sunflower oil, and vegetable oils, as well as trans fats, palm oil, and most packaged foods containing any fat, because that fat is usually saturated fat, and saturated fat is inflammatory. So that is the first step. You have to remove these things that if you are suffering from chronic inflammation. And then gradually we can reintroduce by elimination method. Of course, only the gluten and dairy can be tried to reintroduce. I would not advise to add any refined sugar, or even vegetable oils are not completely remove them. Later on, you can reintroduce and have some of the vegetable oil and some of the seed oils and some omega-3 oils. So we'll come to that later on. Autoimmune diseases such as rheumatoid arthritis, lupus, multiple sclerosis, and inflammatory bowel disease occur when the immune system mistakenly attacks the body's own tissues, leading to chronic inflammation and various health complications. Effective management of these conditions requires a multifaceted approach, including medication, lifestyle changes, and dietary interventions. An anti-inflammatory diet is a key strategy for reducing inflammation, improving immune function, and promoting overall health. No matter how balanced or nutrient-dense your meals are, your body can't heal if you are undernourished. This is one more important point, because most people, in the name of going for a diet, they will reduce the diet so much that they become undernourished, and being undernourished is also inflammatory. That will cause inflammation in your body. So it is important to be properly nourished. For those managing chronic illness, getting enough restorative sleep is a key to reducing inflammation and improving overall health. Here's why sleep is so crucial. During deep sleep, your body enters a repair mode. It's during this time that the damaged tissues heal, inflammation subsides, and the immune system is strengthened. For those with chronic illness, this healing phase is very crucial. If you don't get enough sleep, your body misses out on these restorative processes, leading to prolonged inflammation and delayed recovery. Quality sleep allows your body to fight inflammation at cellular level, improving overall function. Lack of sleep triggers an increase in cortisol. Cortisol is again an inflammatory hormone which causes inflammation, the body's primary stress hormone. High cortisol levels can prevent the production of cytokines, which are the molecules that reduce inflammation and trigger the body's healing processes. When we consistently get enough sleep, our body's stress hormone levels are better regulated. This helps keep inflammation under control, making it easier to manage symptoms and prevent flare-ups. Balanced hormones lead to better emotional and physical resilience. Incorporating sleep as a part of your self-care routine is vital for managing chronic illness and to reduce inflammation. Similarly, physical activity plays an important role in reducing inflammation. While living with chronic illness, it can be challenging to engage in physical activity without feeling overwhelmed or exacerbating your symptoms. So there are some gentle movement strategies to consider. Walking is a low impact exercise that can be easily adjusted to your energy levels. Whatever is a leisurely stroll, whether it's a leisurely stroll around your neighborhood or a gentle walk in nature, nature is again healing. If you go for a gentle walk in nature, that will heal you. This form of movement encourages circulation and can lift your mood. Aim for short walks and gradually increase your distance as you feel more comfortable. Simple stretching routines can help elevate tension and improve mobility. Spend a few minutes each day focusing on areas of your body that feel tight or sore. Incorporate stretches that feel good to you and listen to your body's signal. Don't overdo. If you overdo, that will also cause inflammation. So it is important that you do just the right stretching for you. The moment you start feeling hurt, stop there. Stretching can also be done while seated or even while lying down. So it is not necessary that if you're not able to get up or if you are bedridden, you cannot heal inflammation. You still can. You can do some stretches while lying down as well. And gradually, I remember of case I had read, that person was wheelchair bound, and he was told that he will not be able to walk for all his life. But he did not give up, and he started doing yoga. So gradually, in sitting position, he started doing the stretches and strengthened his upper body. And once his upper body was strengthened, he gradually started strengthening his core. He did breathing exercise to strengthen his diaphragm. And then gradually he started with his foot, started doing stretching exercises with his foot and then leg. And gradually he could get up, walk, and then he even participated in a marathon. So nothing is impossible if you don't give up. Little steps, little by little, gradual and consistently. Do it consistently. That is more important. Rather than intensity, consistency is more important in physical workouts. Pay attention to how your body responds to different movements. Some days you may have more energy, while other days might require a more restorative approach. So just listen to your body. Keep a journal to track your activity and how they affect your symptoms. If you think your body is affected by a certain movement, stop it. Try and change it. This awareness will help you discover what works best for you over time. Remember, movement doesn't have to be intense to be beneficial. The key is to find what feels good for your body and to prioritize consistency over intensity. Again, deficiencies. This is one more important topic which is responsible for inflammation in your body. If you are deficient in a certain vitamin, mineral, enzyme, hormone, or deficient in any nutrient in your body, maybe a macro or a micronutrient, it can cause inflammation in your body. So the human body is a beautiful and incredibly complex machine. From the moment that you think about food, your body begins the process to activate digestion. You haven't even had your first bolus in your mouth, but even if you think that you are going to eat now, that thought activates digestion. When you swallow your food, your body begins the exquisite orchestra of digestion, absorbing all the amazing nutrition or lack of nutrition. Of course, it depends on what food you're having, into your cells to use for brain function, metabolism, hormonal function, and the list goes on and on. For example, your body needs iodine, selenium, zinc to convert thyroid hormones into their active forms. In order for your cells to create energy through the Krebs cycle, you need iron, magnesium, and B vitamins. Perhaps a better illustration of our need for nutrients are the diseases that led us to the discovery of nutrients in the first place. We know that scurvy is a disease that can cause gums to bleed and teeth to fall out and is caused by vitamin C deficiency. So that means vitamin C, if it is an anti-inflammatory food, if it is deficient in your body, it will cause inflammation. Rickets, a disease where the bones of children fail to calcify or grow correctly, is vitamin D deficiency. Beriberi, a disease that affects either the cardiovascular system or nervous system, is due to B1 deficiency. So nutrients are a must for your body to grow correctly and function optimally. So when we take history in our clinic, we usually make sure that we ask the patient for supplements, of what all supplements are you consuming, and to make sure what are the signs and symptoms of any vitamin or any micronutrient deficiency. So we make sure that we supplement that. Okay, function optimally. Let's imagine that you are eating many depleting foods. Depleting foods are foods that will not only that are not only deficient in nutrition, but they contain certain additives or preservatives or substances that will harm your body. Such foods are called depleting foods. So if you are eating many depleting foods, these foods are not just starving physiological processes and your gut microbiome, but they also strip your body of nutrients because it is costly to digest them and escort them out of the body. So the body has to work hard to throw these toxins out of the body. So instead of the nutrients working for your body, they start working for removing the toxins. So it's a double load on your body. First thing, you don't get the nutrition. Second thing, you have to push these back out of the body to remove the toxins. So the body has to work double hard and it does not get anything. So it's a loss-loss situation for the body. And they add nothing in return. In fact, they can enhance inflammatory processes in the body and contribute to chronic inflammation, the underlying cause of many diseases. In today's society, it is common to grind and hustle. Many people have young children, work full-time jobs with long commutes and take additional time-consuming commitments. Nutrition and health habits can easily suffer, and depletion is a common state. Depletion can show up in various ways: exhaustion, digestive issues, skin issues, hormonal issues, achiness in your body, trouble sleeping, and many more vague symptoms. Are any of these areas showing up for you? Listen. For food to be healing, a lot of it depends on how you eat your food. This is again another important thing. Are you chewing your food? Are you eating while watching screens? Let's learn why these actions make a difference and how to take steps today to eat mindfully. So if you want your food to be non-inflammatory, the first step is chew your food properly. The way we eat can enhance or inhibit the absorption of nutrients. Ideally, when we swallow our food, our digestive system kicks into gear, and without any directives from our brain, the digestive system takes care of everything on its own. It's also called the second brain, and research even suggests that it was originally the first brain or the original brain. The bolus of food moves through the digestive system by the squeezing of smooth muscle along the digestive tract, also called peristalsis. As it passes through the upper digestive tract, it mixes with the stomach acid and enzymes. And it continues through the small intestine. It breaks down as nutrients, and the nutrients are absorbed through the lining. Whatever our bodies are unable to use passes into the colon and becomes food for gut bacteria. The remainder exits our system. The trick is that digestive process only functions optimally in the parasympathetic nervous system state. It is often called the rest and digest state. Usually, if you see, previously people used to sit quietly while eating. They wouldn't talk of anything. They wouldn't talk of any negative thing, or would just concentrate on eating, and they would take some rest after eating. So that was really wise. It is important. So the trick is to have the rest and digest state. The alternative to this nervous system state is called the sympathetic nervous system, which is often called the fight or flight state. This is the reason why it is advised that sit quietly and have your food. Don't have your food while you're rushing. We ideally are oscillating back and forth between these two states all day long. When we are in the sympathetic mode, we are ready to act. Our blood glucose levels rise, blood travel to our extremities, and our pupils are dilated. Non-essential systems don't work as well. Systems like our digestive system doesn't work at that time when you are in a fight and flight mode, because your body is desperate to do that task. So all of the energy is just focused on that task, and your digestion does not work at that time. The blood flow and all the energy of your body is focused on that particular task. So the trouble with today's grind culture is that too often we are in the sympathetic mode. And there are so many clients with the keyboard in their picture, and they are working and they're eating. So the movement of food through the digestive tract through smooth muscle contractions is known as peristalsis. The parasympathetic nervous system stimulates this process. But if you're always in the sympathetic mode, the parasympathetic system will not work. One will work at a time. Perhaps you can relate. Sometimes it's hard to have a bowel movement when you are busy and on the move. But when you are relaxed and in your routine, your bowel movements happen like clockwise. What state do you find yourself when you are eating? Do you eat during meetings or watching an exciting television show or movie? Or while you are driving? Do you find that sometimes your food just disappears while you're busy somewhere else? You just go on eating. When I eat distractedly, this is what happens. Whatever I eat is suddenly gone, and I feel a bit sad that I wasn't aware of the delicious flavors. So eating mindfully. Number one is to chew slowly and gradually. Number two is eat mindfully in a quiet mode. Sit, relax, and then eat. So this is the first thing you need to do to lower your inflammation. All right. So I feel the same when I fall asleep during a massage. How to take steps to eat more mindfully. Ask yourself how aware I am of my chewing. When we stop to focus on chewing, it will automatically bring you into a more mindful state. So you have to take a stop, chew slowly, concentrate, focus on the food you are chewing, focus on the flavors, focus on what you are eating, and enjoy your food. That is what is important. So if you do this, this is the first steps towards thwarting or towards eradicating inflammation. So first is chew your food slowly and be mindful while you're eating. It will automatically bring you in a more mindful state. Chewing will not only help you eat more mindfully, it will mix your food with saliva, which contains helpful enzymes to begin the breakdown process when we swallow. The glucose breakdown already starts in your saliva. Plus, chewing pushes your body to switch into a parasympathetic mode. If you chew slowly, the body feels that slowness, that restfulness, and it will go into a parasympathetic mode. It will get out of that fight and flight mode and it will relax. And once the parasympathetic mode is activated, your digestion process will begin. So it is really important to chew your food and to sit quietly without any disturbance. Eat your food mindfully. So the second thing is dehydration. Dehydration is also inflammatory. We all know it's important to drink water. But knowing something is not the same as doing something. I have to remind myself daily to hydrate. If you have issues with constipation, incorporating a glass of water first thing in the morning can do wonders. I had a client share that it was like magic on her bowels. Another client had issues with fatigue, and increasing her water intake was a game changer. So let's explore why. Our body is roughly 60 to 70% of water, and according to the National Institute of Health, symptoms of dehydration such as fatigue, brain fog, irritability, or depression can show with as little as 1% deficit. We excrete water in a lot of ways. We sweat, we urinate, we defecate. If we exercise in heat, the amount of water we excrete can be 3 to 4 liters per hour. One is because of the exercise and the other is because of the heat. So it doubles up. 10% dehydration is life-threatening. Think about stories you've heard about hikers wandering off paths and dying out of heat exposure. So only dehydration can kill you as well. So what does all the water do for us? It helps to think about the role that the blood plays in the body. One function is to deliver oxygen. So if your blood is in a fluid state or it contains the normal or the required amount of water, only then it can deliver oxygen to your cells. It can deliver nutrition to your cells and chemical signals to all of your cells, and also transport the waste products. So without adequate hydration, your blood has less volume than it should, and all these functions are impaired. Also, dehydration affects your joints. Your synovial fluid is also in the fluid form. So if you're dehydrated, you can tend to have more joint pains than usual. So if you, at times, there are many patients whom we will just advise that you hydrate yourself sufficiently and their joints improve. So dehydration can also give you symptoms of arthritis. Anti-inflammatory food list. Fruits, they have powerful phytonutrients, antioxidants, high amount of fiber. Fiber is anti-inflammatory. One more thing that is anti-inflammatory. Vitamin C that reduces inflammation. Vegetables, no surprise here. Vegetables contain high amount of antioxidants and polyphenols, which are protective compounds within the plant's cell. High fiber grains and starches. Whole grain bread, pasta, quinoa, and oats are excellent sources. These foods are packed with fiber, which help improve bowel movements, bloating, blood sugars, blood pressure, and cholesterol levels. And along with high grain, in the whole grain bread, I mean, it could be oats, it could be millets, it could be gluten if it works with you. If it is causing inflammation, then of course that is out of question. And if we are starting treatment, we would prefer keeping gluten away and go for more for millets and for oats or quinoa. So high fiber grains and starches are anti-inflammatory. Proteins, fatty fish such as salmon, tuna, and trout, as well as plant-based sources of proteins, including beans, lentils, and tofu. These are all anti-inflammatory. Whereas red meat is inflammatory, definitely, so it's to be avoided. Fats. Omega-3 fats are fats which have anti-inflammatory properties. Fats have a bad reputation, but they are not bad at all because there are so many body functions which we cannot do without fat. Our hormones are made of fat, and there are so many prostaglandins which work for inflammation. They are made of fat. So it is, our brain needs fat. So it is important to have fat in your body, but we need to have a check of what kind of fat we are introducing into the body. So things like nuts, seeds, chia seeds, flax seeds, avocados, and olive oil. These are all rich in omega-3 fatty acids. So they are good for your body. High fiber foods are anti-inflammatory. Herbs and spices are anti-inflammatory. Spice foods with garlic, ginger, turmeric, and cinnamon. These ingredients are simple to incorporate in your teas, soups, and smoothies and have inherent anti-inflammatory qualities. In my kitchen, I usually have, on the right side, there is a space where I have all these powders. It's ginger powder, cinnamon powder, clove powder, and cardamom powder, and black pepper. I will usually add a pinch of all these to my soups or my teas. And it keeps you away from inflammation, definitely. Spices like rosemary, clove, sage, cumin, they have immense anti-inflammatory properties. They can be used in your curries, they can be used in your soups, you can make herbal teas. So even minute quantities of these spices have the potential to reduce oxidative stress. Anti-inflammatory drinks and probiotics. Green teas, herbal infusions, turmeric, milk, ginger tea, they are loaded with antioxidants that can help lower inflammation. Further, probiotics like fermented food and yogurt, they can keep the gut microbiome healthy to fight inflammations. Avoid processed foods. Steer clear of highly processed meals, trans fats, refined carbs. They can cause inflammation. So it is important to swap them with home cooked meals made with natural and whole ingredients. Packaged foods have zero nutritional value and are high in saturated fats, trans fats, added sugars, excessive salts, which can raise bad or the LDL cholesterol. It can increase your blood pressure and your blood sugar levels. So usually whatever is packed contains all this. So it is important to go for whole fresh foods. Go for fresh fruits, whole fruits, and whole vegetables rather than going for juices or ready to eat foods. So this is the list of anti-inflammatory foods which I have just created, just so that it's easy for you. In vegetables, it's asparagus, beets, broccoli, Brussels sprouts, carrots, cauliflower, kale, mushrooms, spinach, peppers, fennel. Fennel is a very good anti-inflammatory product. Also pak choy, string beans, starches, corn squash, butternut squash, jicama, pumpkin, red potatoes, sweet potatoes, white potatoes, spaghetti squash, gold potatoes, parsnips, and artichokes. Grains like amaranth, barley, black rice, brown rice, buckwheat, corn, farro, millets, oats, quinoa, and wild rice. These are the healthiest or the anti-inflammatory grains, you can say. Fats. Anti-inflammatory fats are almonds, avocado, Brazil nuts, cashews, chia seeds, olives, peanuts, pumpkin seeds, canola oil, sunflower seeds, walnuts, and then is the protein list. So in the fats, if you see, there are seed oils and nuts as well. It's peanuts also, and it's sunflower seeds as well. So when I say things like almonds, avocado, Brazil nuts, cashew nuts, these contain mainly olives, or these mainly contain omega-3s. But at the same time, I have not written flax seeds. Flax seeds is also important. Okay. So your body needs not only omega-3, it needs omega-6 as well. But there is a ratio that has to be maintained. If you are using 3 parts of omega-6, at least 1 part of omega-3 should be used in your daily diet. Or if it is 1:1, that is the best. Used whatever oil you are using in the day, use half of it from seeds, and half of it use olive oil, or you can use cow's ghee as well. So it is important to maintain that ratio. It shouldn't be only omega-6. What you get, the packaged food, they contain mainly omega-6 only. And there are certain prostaglandins that are produced by cytokines that are produced by inflammatory foods, by the oils. But with omega-6, it is used to produce both inflammatory and non-inflammatory cytokines. Whereas with omega-3, it will produce only anti-inflammatory cytokines. So it is always healthier to eat omega-3 rich oils. So it is healthier to eat almond oil, avocado oil, Brazil nut, cashews, chia seeds, olive oil, or sunflower seeds is a mixture of omega-6 and 9 and 3. And the omega-6 is high in that. And walnuts are again omega-3. So it is important to maintain that ratio. And proteins. So the anti-inflammatory proteins are edamame, tofu, soy milk, crab, flounder, oysters, salmon, shrimp, snapper, tuna, snapper. So, and of course, legumes and beans as well. So these are anti-inflammatory proteins. The red meat or processed meat is an absolute no-no. If you are suffering from inflammation, please avoid red meat. Please avoid processed meat, any processed food for that matter, that is highly inflammatory. Fruits, apple, blackberries, cantaloupe, kiwi, lemons, fruits. Nearly all the fruits are good for you. They are anti-inflammatory. But the one thing that I would advise is take fruit in the first part of the day, before the sun is overhead. After the sun starts setting, avoid fruits. And it is advisable to have your salads during your lunch. And it is always good that you have your dinner very light. And among that, there is a certain lentil called moong dal, which is highly anti-inflammatory. It is the best thing you can have for your dinner. It is light, it is digested easily, and it has anti-inflammatory properties as well. And yeah, so the other oils are almond butter, almond oil, avocado oil, cashew butter, flaxseed oil, peanut butter, olive oil, walnut oil, hemp seed oil. So these are just the few things which I've listed as anti-inflammatory foods. So basically, anti-inflammatory food is good protein, good fat, good carbs. And yes, one thing which I haven't mentioned in over here is that eating enough is anti-inflammatory. If you eat more than required, it is inflammatory. Because your body has to work hard to digest the extra food which is not required by you. So whenever you start feeling that you are full, just stop eating before that. Don't eat until you are full, and don't overeat even after that. If you do that, your body will keep working hard to digest all the food, and it will not get time for healing. So you will never be able to get rid of your inflammation. So to get rid of inflammation, it is important to eat just enough or less than enough, but don't overeat. Okay, so this is for today. If you have any questions, if you need any help with inflammatory diet, you can please book a pre-consultation with me, and I can make customized diets for you based on what you eat. And we have this Faith Fitness 3-in-1 online program, which is there on our website. You can just go visit and see. We are also running a 50% off on this program at the moment. So you can definitely take some benefit of that. If you need some help, you can contact us on this number, email, or through our website. Thank you very much for listening. Hope it is of some help to you today.
Thank you, Dr. Geeta. If anybody has question, let me stop recording. That helps sometimes.